Did you know that lung cancer is one of the deadliest cancers and 95% of people miss its early warning signs? Most people don't realize the subtle symptoms that could be alerting them to something much more serious. In this video, we're going to uncover the 10 lung cancer signs that are often ignored, but shouldn't be. Stay with me until the end, because knowing these signs could save your life or the life of someone you love. Let's get started. Number 1. Persistent cough. Now, everyone has had a cough from time to time, whether it's from a cold, allergies, or dry air. But the key here is persistence. If you've had a cough that lingers for weeks, especially one that gets worse or changes in character, it's time to take notice. Most people brush it off, thinking it's just the season or something minor. But when a cough lasts too long, it can be more than just an irritation. Lung cancer-related coughs can start out dry, then progress to producing mucus or even blood. This happens because tumors in the lungs irritate or block airways, causing your body to react. People often overlook this sign, especially if they're smokers, assuming it's just a smoker's cough. But when a cough doesn't go away, it can be a red flag that something deeper is happening inside your lungs. The cancerous cells disrupt the respiratory system, making it harder for your lungs to function normally. If this is sounding familiar, or if you know someone who's been coughing for a while, it's important to see a doctor. Early detection can change everything. Don't wait for it to get worse. Pay attention to your body, especially when it's telling you something isn't right. Number 2. Shortness of breath. Now, we're not talking about feeling winded after a workout or a run, but rather experiencing difficulty breathing during everyday activities, like walking up a flight of stairs, carrying groceries, or even just talking. This is a huge warning sign that something might be wrong with your lungs. When lung cancer begins to obstruct airways or cause fluid to build up around the lungs, it restricts airflow. And because of this, you feel like you can't get enough air, even when you're doing something simple. People often mistake this for aging, being out of shape, or even asthma. But if it comes out of nowhere or gradually worsens over time, it's a reason to get checked. Shortness of breath can also indicate fluid buildup in the chest, a condition called pleural effusion, where the fluid prevents the lungs from expanding fully. What many don't realize is that this is a common complication of lung cancer, yet it's dismissed until it becomes severe. If you're finding it harder and harder to breathe, don't ignore it. You might feel tempted to just push through, but remember, your body is trying to tell you something. Catching this early could mean the difference between manageable treatment and something far more advanced. Take shortness of breath seriously and consult your doctor before it progresses. The earlier you address it, the more options you have to fight back. Number 3. Chest pain. Not all chest pain feels the same, but when it's tied to lung cancer, it's often persistent and linked to tumors pressing on the chest wall, ribs, or even nerves. While people usually think of heart problems when they experience chest pain, lung cancer is often overlooked. The pain can be sharp, stabbing, or even a constant dull ache, especially when you take a deep breath, laugh, or cough. A common mistake is attributing this pain to something minor like a pulled muscle or indigestion. But here's where things get serious. If you've been feeling this type of chest pain for a while, especially without any obvious injury, it's time to investigate. Lung cancer often spreads to the lining around the lungs, causing inflammation and discomfort. Again, you don't want to wait until the pain becomes unbearable. Any persistent, unexplained chest pain, whether it's mild or intense, deserves attention. It could be your body signaling a much bigger problem than you think. Number 4. Unexplained weight loss. We've all heard stories of people losing weight without even trying and thinking it's a good thing. But here's the reality. Sudden, unexplained weight loss can be a serious warning sign of lung cancer. Cancer cells consume a lot of energy, and as they spread, they trigger metabolic changes in the body that burn calories faster than normal. This means that even if you're eating the same amount of food and living your usual lifestyle, you could start dropping pounds unexpectedly. While most people think of weight loss as a welcome surprise, in this case, it could be the first indicator that something's wrong. If you notice your clothes getting looser, the numbers on the scale dropping, and you haven't made any changes to your diet or activity levels, take note. It's not just about looking slimmer. This could be a sign that your body is fighting something serious. Pay attention and don't brush it off as just a fluke. Talk to a healthcare provider and rule out any potential issues early on. Number 5. Wheezing. Wheezing is that high-pitched whistling sound you hear when you breathe. While it's often associated with asthma or allergies, wheezing can also be a symptom of lung cancer. When a tumor blocks or narrows airways, it restricts the flow of air, making it hard to breathe normally. This is what causes that characteristic wheezing sound. What's tricky is that many people assume it's just asthma flaring up or an allergic reaction, and they might try using an inhaler or taking allergy medicine. But if the wheezing doesn't go away or gets worse, it's time to consider that something else might be going on. Maybe there's an obstruction in your lungs, and ignoring it could lead to delayed diagnosis. Don't wait for other symptoms to pile up. If you notice persistent wheezing that doesn't respond to typical treatments, it's worth getting checked out. Early intervention could be key to preventing lung cancer from progressing. Number 6. Fatigue. We all get tired, but this kind of fatigue is different. It's an overwhelming sense of exhaustion that no amount of sleep seems to fix. You might feel wiped out after doing everyday tasks that wouldn't normally tire you, or you may just feel constantly drained for no obvious reason. Lung cancer drains the body's resources, and the energy needed to fight the disease can leave you feeling like you've got nothing left in the tank. It's easy to dismiss this as just being overworked or stressed, but if you're experiencing extreme fatigue that doesn't go away, it could be a sign of something more serious. The important thing to remember is that this fatigue doesn't improve with rest. So, if you're feeling unusually worn out and can't seem to shake it, don't ignore it. Get it checked out. It could be your body's way of signaling that your lungs need help. Remember, cancer is not something to ignore, and knowing its symptoms can help you catch it earlier and potentially save your life. Don't forget to hit that subscribe button if you haven't already, and stay up to date on all of our latest content on staying healthy and fighting disease. Number 7. Hoarseness. You might think that hoarseness is just a result of a sore throat or overusing your voice, but if it persists for more than a few weeks, it could be an early sign of lung cancer. A tumor in the lungs can press on the nerves that control the voice box, leading to changes in your voice. This is often one of the most overlooked signs because people don't usually associate hoarseness with their lungs. But if your voice has been sounding rough, raspy, or you're losing it entirely without a clear cause, it's time to take it seriously. Pay attention to any lingering changes in your voice, especially if they're accompanied by other symptoms like coughing or shortness of breath. It's better to be safe than sorry when it comes to something as critical as lung health. Number 8. Recurring respiratory infections. If you've noticed that you're constantly battling bronchitis, pneumonia, or other lung infections, it could be more than just bad luck. Lung cancer weakens the immune system and damages lung tissue, making it easier for infections to take hold and harder for your body to fight them off. A tumor in the lungs can also create blockages, trapping bacteria and viruses, which leads to recurrent infections. If you find yourself getting sick over and over again, with little recovery time in between, it's worth considering that there might be an underlying cause, such as lung cancer. Don't just keep taking antibiotics and hoping for the best. Recurrent infections are a sign that something isn't working right in your lungs, and it's time to get to the bottom of it. Number 9. Bone pain. Lung cancer, when advanced, can spread to other parts of the body, including the bones. This spreading is called metastasis, and when cancer reaches the bones, it causes significant discomfort and pain. Unlike the usual aches from physical activity or minor injuries, this bone pain is persistent and often described as deep, throbbing, or sharp. It can occur in areas such as the back, hips, or ribs, and often worsens at night or during physical activities. Many people ignore this pain, assuming it's just arthritis or age-related wear and tear. But if the pain is persistent and doesn't respond to regular over-the-counter painkillers, it's crucial to get it checked out. Bone pain related to lung cancer can indicate that the cancer is spreading, making early detection even more critical. Always take new, unexplained bone pain seriously, especially if it doesn't go away. Number 10. Clubbed fingernails. This is a lesser-known symptom, but an important one. Clubbing refers to the enlargement of the fingertips and a change in the shape of your fingernails. The nails may start curving downward and look more rounded at the tip. This happens because lung cancer can reduce oxygen levels in the blood, and the body reacts by altering the tissue in the fingers. While it might seem like a minor cosmetic change, clubbed fingernails are a serious sign of underlying health issues, including lung cancer. Many people dismiss it as harmless, but if you notice this change, particularly if you're experiencing other symptoms like a persistent cough or shortness of breath, it's important to consult your doctor. If you found any of these signs familiar, don't wait. Early detection is key to treating lung cancer successfully. Please give this video a thumbs up if you found it helpful and share it with friends and family. It could save a life. And don't forget to subscribe to our channel for more health tips. Your health is worth it.